Well, COVID-19 has hit all of us very hard, but I'm hearing from a lot of parents who are desperately searching for answers and need advice during these trying times. So joining us via Zoom to answer your most pressing questions is board-certified pediatrician and parenting expert, Dr. Jen Trachtenberg. Jen, we have a lot to tackle here, so let's get started with the latest report that kids can actually be super spreaders.
Right. So really what the report showed is that in this study, kids who had minimal symptoms, they actually had a higher viral load in their nose than really sick adults that were in the hospital. So the assumption is that they may be able to spread it more, but we don't really know that because we weren't really testing so many kids early on. But probably what's most important to take from that is even with kids, you need to be careful and take precautions as well, too.
So let's break a couple things down here. So you say viral load. What do you mean by viral load?
Well, that's basically the amount of virus that's in their body or that they were able to test. So the more you have, the assumption is the more ability or sicker you are that you can spread it.
Exactly. So when we say super spreaders, what do we mean by that term super spreader?
Super spreaders really means that one person can spread it to a lot of people more easily than somebody else. But again, this study was just a suggestion of that. It didn't actually show that to be the case.
And do we know why we're finding a higher viral amount or load in kids versus adults?
So we really don't know that for now. So again, more studies need to be shown to really tease that out.
Exactly. So in your practice, have you found any differences between the symptoms, the COVID-19 symptoms between adults versus children?
Sure. Well, it can be really crazy when it comes with kids because there are so many symptoms similar to many other illnesses that kids get. So kids can get fever, but it's usually not the presenting sign as it is in adults. They can have headaches, coughs, sore throat. Kids are more likely to have runny noses than adults when they have COVID, as well as stomach aches, vomiting, and diarrhea too. So it kind of runs the gamut.
When do you keep your kids at home?
Anytime they have any symptoms at all, they should be staying home until they're feeling better and not sick anymore. And in addition, if your child comes in contact with a real exposure of someone who has COVID, you want to make sure that they stay home as well too, because you don't want them to then get it and spread it. So if they have a close contact, which is important to note, closer than 6 feet, but with contact for at least 15 minutes or so, that's considered an exposure. And so you really have to be prepared. If your child has slight cough, they need to stay home because it may be COVID and you don't want to infect anyone else. And so it's really this balance, and it's hard for working moms and working dads, parents, that you think you're sending your child to school, but with any little illness or symptom that they need to stay home, and you have to have other plans for remote learning as well.